Hello, and welcome to APTI Oncology, an Academy of the American Physical Therapy Association, Student and New Professional Subcommittee, Diagnoses Downloads. This month, we are focusing on liver cancer, and today we will be diving in to discuss the various types of liver cancer, its typical treatments, the clinical implications, and of course, the physical therapist's role throughout the continuum of cancer care. Thanks for tuning in, and let's get started. To begin with, let's answer the question, what is liver cancer? Well, liver cancer is a cancer that starts in the cells of the liver and the adjoining tissues. Hepatocytes are the primary cell type in the liver, but there are three more that make up the four major cell types that work together to maintain liver functions. The other cell types are hepatic stellate cells, Kupffer cells, and liver sinusoidal endothelial cells. Again, those three, along with the hepatocytes, work together to maintain the functions of the liver. So liver cancer then disrupts the function of the liver, and these functions include help making clotting factors to prevent excessive bleeding, help break down, absorb, and store nutrients, and break down alcohol, drugs, and toxins in the blood so that they can be excreted from the body. There are a few major types of liver cancer that we will talk about today. Hepatocellular carcinoma is the most common, and this liver cancer derives from the hepatocytes, which we said were the primary cell type. There's also cholangiocarcinoma, which is a bile duct cancer, and that forms in the bile ducts, which are closely associated with the liver, as they help move bile from the liver and the gallbladder to the small intestine. We also just want to mention metastatic liver cancer too, which is cancer cells from a different part of the body that spread to the liver. The liver can be a common site of metastasis, so we wanted to mention that as well. Common signs and symptoms of liver cancer include weight loss, loss of appetite, nausea or vomiting, pain in the abdomen or the right shoulder, enlarged liver or spleen, swelling in the abdomen, and jaundice of the skin or eyes. As far as the treatments for liver cancer, there is a few that we'll touch on today. Chemotherapy and radiation therapy can be used for liver cancer as they can be with most cancers. There are a few surgical options that we will touch on as well, and then there's also targeted drug therapy and immunotherapy. Back to the surgical options, the type that is best depends on the type of cancer as well as the stage of cancer. You have surgical resection, which goes and removes the actual tumor. There is also ablation, which destroys liver tumors without removing them, and it is a minimally invasive procedure. There is also embolization, which blocks or reduces the blood flow to a tumor in order to slow the growth. This works well with liver cancer because the liver has two blood supplies through the portal vein and the hepatic artery. Liver transplant can also be an option, again depending on the type and stage as well as other health factors of the patient. Clinical implications of liver cancer, we're going to talk about a few different things here. So to begin with, chronic hepatitis B and C infection, cirrhosis, obesity, and type 2 diabetes mellitus are risk factors for liver cancer. Frailty, sarcopenia, obesity, and anaerobic threshold can be prognostic factors. Prehabilitation may shorten postoperative hospital stay and improve outcome measures if done prior to those surgical treatment options we talked about above. And that's because they can make an impact on those prognostic factors that we just touched on above. Studies have also demonstrated higher survival rates in those receiving cancer rehabilitation, and that is including along the continuum of care, not just in a prehabilitation setting. Okay, so now that we have talked more about what liver cancer is, as well as its clinical implications, Let's dive into the physical therapist's role in treating patients with liver cancer. First, our role is to screen. As with all patients, we should be performing a review of systems, and here specifically, we should be screening the gastrointestinal system, identifying any red flags, and utilizing differential diagnosis to make a good referral to the proper healthcare providers in the event that there are signs and symptoms of liver cancer. Our next role is in prehabilitation. As we said earlier, physical therapy prehab before surgical treatment may lead to better outcomes. Next, our role is to intervene. We are able to identify and treat impairments from liver cancer and also from the different treatment options that we mentioned before. We are able to identify the impairments caused directly from liver cancer or ones that may come along throughout the entire spectrum of cancer care as they go through these other treatment options to fight the cancer. Lastly, our physical therapist's role is to educate. We should be promoting physical therapy from diagnosis through survivorship to improve the quality of life and outcomes of these patients where appropriate. Now that we've talked about the physical therapist's role in treating liver cancer, let's talk about the 4 main takeaways from this presentation. 1. There are modifiable risk factors related to the development of liver cancer. 2. Physical therapists can aid in addressing impairments along the entire treatment spectrum. 3. Cancer rehabilitation and prehabilitation may contribute to better outcomes and increased survival rates. 4. We should advocate for lifelong physical activity to decrease risk factors and also poor prognostic indicators of liver cancer. Lastly, this is a list of the sources that I used to create this presentation. If you had any further questions or wanted to see more details on anything that I mentioned, I highly encourage you to look at these sources as they helped me see the big picture of cancer rehabilitation and its role with liver cancer. Thanks again for tuning in today, and we hope that this helped you see what impact we can make on patients with liver cancer if they walk into our clinic or any setting of physical therapy. Thank you. Have a great day.